Many dog owners think that since their beloved pet spends most of their time indoors, there's no need to worry about heartworms, right? Wrong. It only takes one mosquito bite from the wrong mosquito for a dog to become infected. I have seen firsthand what heartworms can do and have researched more on the subject to share with you. Today, I want to talk about heartworms specifically in dogs. First, I will describe exactly what a heartworm is. Next, I'll explain what causes heartworms. Then, I will list ways it can be prevented. Finally, I will talk about how it can be diagnosed and treated. You may be wondering, what exactly is a heartworm? According to the ASPCA, the American Society for the Prevention of Cruelty to Animals, the definition of a heartworm is a parasitic worm that lives in the heart and pulmonary arteries of an infected animal. A dog is a natural host for heartworms. This means that heartworms that live inside a dog will mature into adults, mate, and produce offspring. These worms travel through the animal's bloodstream and can harm the arteries and vital organs along the way. They eventually make their way to the vessels in the lungs and heart chamber about 6 months after the initial infection. Heartworms enter as tiny invisible larvae, but they can grow in lengths of more than a foot long at maturity. Now that you have a better idea of what a heartworm is, we can talk about what causes them. Heartworms are transmitted from animal to animal by mosquitoes. The life cycle of a heartworm is very complex. This is because an animal must carry at least 2 heartworms, one being male and one being female, in order for the female worm to reproduce. Females produce babies called microfilariae. These babies shed into the animal's bloodstream that aren't capable of causing heartworms until they've passed through another mosquito. Once the babies are taken up by a mosquito, they will transform into infected larvae. This usually takes about 2 weeks for the whole process. After this, that mosquito can bite a new victim, and the infected larvae will enter the tissues and begin its migration towards the blood vessels. The life cycle of a heartworm is tricky, but preventing it can be fairly easy. There are a variety of different brands of chewable tablets you can give a dog that come in monthly doses and even 3-month doses. My veterinarian gives my dog a 6-month injection that protects him for a year, or protects him for 6 months, so I only have to give it to him twice a year. I find this to be the most cost-effective solution. The most recent recommendation from the American Heartworm Society is to give your dog preventative all year long and not just in the spring and summer months. So, since some of these preventatives can also prevent other intestinal parasites, they're good to have around year-round. Heartworms are easy to prevent, but sadly they can be difficult to treat. Let's just talk about how a dog can be diagnosed and then how it's treated for heartworms. Many dogs show few symptoms or none at all in the early stages of this disease, but some signs of heartworms can include a mild persistent cough, lack of wanting to exercise, decreased appetite, and even weight loss. A dog can be diagnosed by examinations, radiographs, and ultrasounds, but ultimately a veterinarian needs to administer a blood test to be able to test positive, according to the ASPCA. Each dog is then evaluated and determined the best course of treatment and any risks that might be involved. The most common treatment is a series of injections of a drug called adulticides in the infected dog's muscle. This option has a high success rate but can require a stay at the vet. No matter the treatment, they all require the dog to be on a strict exercise restriction for several weeks. After the treatment, the dog should be put on a preventative to reduce the risk of infection again. So today I talked to you about heartworms in dogs. I first described what a heartworm was and explained what causes heartworms. Then I listed ways it can be prevented. Finally, I talked to you about how it can be diagnosed and treated. I hope all of this has given you a better insight about this disease for any dogs you may have or may have in the future. Thank you.